Excellent.
Okay, well, we will get started here. Thanks for coming for those that are on, and for people who aren't on here, we can have this available for later so that anyone could see it. My name is Christine Brown, and clinical research assistant, self-advocate faculty with David Ellsworth and Lauren Hackenberg. We're here to share with you all our direct support professional workforce crisis survey. This has been a very long time in year 1 and 2 of our work. And so I'm gonna let David take over first to go over this. Thanks.
Thanks, Christine. And thanks for joining us here today. This is the culmination of a 2-year project and a lot of work. So we're really proud of the effort that we put forward on this. And the title of our presentation is The Direct Support Professional Workforce, Empowering Ohio's DSPs. I'm David Ellsworth. I am the PI for the Ohio Disability and Health Partnership. I'm also on the LEND program. I'm joined by my colleague, Lauren Hackenberg, who's our program coordinator for the Ohio Disability and Health Partnership. And then we had Christine's support throughout this project. And we were very fortunate to have a cohort of about 6 really dedicated LEND trainees at the Nice-Unger Center that helped us with this. So I know a lot of you guys might be familiar with the Nice-Unger Center, but we're a federally funded university center for the excellence on developmental disabilities. I think a real strength of what we do is our interdisciplinary backgrounds, and that was a strength of this project as well. I came in here with very little knowledge of the direct support professional workforce, and I've gained a bit of that, but I think we were able to approach this topic from kind of a almost naive, third party approach that was really objective. So again, we had LEND students that helped us throughout this project, and they brought their experiences as well, as PTs, OTs, nurses, PhD students, PhD fellows, workers in the clinical field. And this was their LEND project. Yeah, self-advocates, you're right.
And family members are part of LEND too.
Exactly. But I think that was a real strength of this work. So why this? This was a project that was really largely driven by Christine. She approached me and said, I think that there's a problem here, and perhaps this would be a good, LEND project to address it. We know that DSPs are critical to the lives of the individuals that they serve, and that they really support them and empower them in all aspects of living. I think that we're all aware that there are some pretty severe wage challenges within this workforce, and that really kind of stymies the level of care that they're able to provide. It also leads to increased turnover, and all of this has negative economic and social consequences that not only impacts the workforce but impacts the people that they serve. If there's one takeaway that people might get from this presentation, I think that this is really a public health issue, and it's not often framed that way. I think we talk about the DSP shortage as something that, obviously impacts the field and impacts the people that they serve, but I think this is more of a population health issue. It affects not only thousands of DSPs, but thousands upon thousands more of the people that they serve. And I think that framing this as a public health issue is a real opportunity to advancing this work and to advocate for higher wages that would allow people in this field to, essentially be compensated for what it's worth. So our project purpose was to gain a deeper understanding of the DSP workforce crisis, to create a survey to distribute to DSP professionals to better understand their needs, challenges, and opportunities. And then finally, to present this back to you guys, to DSPs, to policymakers and stakeholders. DSPs have really complex roles. You know, at any given time, they're serving as a teacher, a nurse, an OT, an occupational therapist, physical therapist, a counselor, a chauffeur, personal trainer. But this position isn't, you know, it doesn't get the recognition it deserves, and it doesn't get the recognition from the US Bureau of Labor Statistics that it needs. And this actually has some pretty far-reaching effects that impacts things like opportunities for accreditation, professional development, and clear pathways for career growth. I will say that Ohio does a pretty good job because it mentions DSPs on Ohio's top jobs list, but it really doesn't have that recognition yet that I think that it needs to be to build a sustainable workforce. So this is just a brief timeline of what our project looked like. Last year, we focused a lot on reaching out to our partners, gaining a better understanding of this field. We wrote a policy brief largely to educate ourselves on this topic. And then we spent a lot of time meeting with partners, making sure that our survey asked the right questions. And I know we worked with a lot of you all on this. This year, our project was entirely focused on analyzing the thousands of long responses that we got from the survey that we distributed to DSPs. And we used a process to kind of sort these into patterns and organize them into themes that we can share back and say, you know, of the thousands of responses that we got, here are the main points that they want to convey. So again, we know that the DSP workforce is projected to grow pretty dramatically, but wage growth and earnings are pretty low. In fact, the median annual salary for DSPs was $27,000, and that's about $500 above the federal poverty level for a family of four. When we first approached this topic, we were discussing DoD's competency-based and longevity add-on, which provided, you know, a pretty modest increase for DSPs who have been in the field for at least 2 years and completed training. It was restricted only to HPCs, and new workers generally didn't qualify. But as happens with most of my policy projects that I'm working on, that policy shifted sort of as we were discussing this, and probably for the better. So
Can I say something?
Yeah, please.
When you go back to that last slide, the thing is on this restricted only to HPC, it's only HPC, not self-directed, not participant-directed HPC or on-site on-call. They were not qualified for that, which I just really feel is not right, because they're a person going from a house that does homemaker personal care, then someone else might be a working with a person that's on self, that's participant directed homemaker personal care. So they start to see that they don't get paid that add-on when they're working under participant directed homemaker personal care, which I feel is wrong, because once they have the add-on certification, they should be able to take that add-on wherever they're working, which is not true right now.
Thanks, Christine. I appreciate that. Get back to my slides here. So in 2022, DoD revised this process and received some federal approval for an investment to support DSPs. This was intended to limit the impact of the nationwide DSP shortage, and payments were distributed quarterly from DoD to participating providers, which then are passed on to eligible DSPs. It expanded pretty significantly those who were eligible to receive those payments. Independent providers were eligible as well. And these retention payments are based on an overall percentage of the claims that are paid each quarter. But agencies can still withhold up to 18% of the retention payment that could be directed towards DSPs, but this must be reported. So just a quick look at salaries and benefits. There are a lot of job openings. Over 21,000 job openings at the time that we published this. But again, the wages are really pretty low, and oftentimes do not support people staying in this field long term. I think that this graph was really interesting. We looked at where DSPs fall with regard to wages for different workers. And if you look at this long enough, I think that you read through them, the direct support professionals are really in between a lot of service industries. Like, for me, this is a real outlier. This is like having, doctors and nurses in the middle of this, where I think that, DSPs are performing a very different, pretty technical role that's similar to a lot of medical professionals, but in terms of wages, they're sandwiched in between a lot of people who are in the service industry. And I think it's useful to consider this when we're thinking about where are we recruiting DSPs from? And if they're leaving, what might they be pivoting into? Because it's, retail and sales, it's one of those jobs where it would be very easy for someone to leave this specialized workforce and do something else that pays more money. And that's something that we kind of saw in our analysis again and again. Christine, I think this is where I'm going to hand it over to you, if that's okay.
So in the National Core Indicators Survey, this is what we found out, that 36.5% of DSPs were employed 36 months or more by the end of December 2019, with this 32.7% DSPs separated from their employer during the first 6 months of their employment, from January 2019 through December of 19. And the turnover rate was averagely 42.8% at that time, and 69.5% offered a form of paid time off, 57.1% offered health insurance to some or all DSPs, 52.7% offered dental coverage, and 48.5% offered vision coverage. We can also say that a lot of these DSPs, their wages are just above the qualifications of Medicaid, that they don't get eligible, but the providers don't make enough to keep up with health insurance costs. That's another factor we were also looking at. Sorry. So like with the impact of the COVID-19 workforce crisis in August, the American Network of Community Options, Anchor, sent out a survey which received 499 responses to assess the current state of the workforce crisis and COVID-19's impact on hiring and retention. 77% of providers are turning away new referrals. 58% of providers are discontinuing programs and services. 81% of providers are struggling to achieve quality standards, and 40% of providers are seeing higher frequencies of reportable incidences. And the effects on the families, it really is a burden with the workforce shortage. Compounding stress can make health conditions worse when the family can't find anyone, and increases the strain on their mental health and forces individuals to go without the care they need or risk being placed in an assisted living facility against their will. An added strain on families struggling to find caregivers. We know in this public health emergency, caregivers, even children of minors, are allowed to be paid providers. But now that the public health emergency is over, we still feel that what can we do for families when of minors, when the son or daughter may have high complex needs and the school is shut down or the individual is sick, the parent having to take time off to be taking care of that child, and losing out on pay if they don't have a job that pays paid vacation or sick days, and they shouldn't really have to do that. So I just wanted to point that out. Okay. So the lens survey. So these are the response of the counties. Summit County, which is where Lauren is from, had the biggest response. And then as you see, the lighter blue, that's the second highest. Then as they go into these lighter colors, that's lower, and the ones with white, those were no responses from those counties. So that's how, and 950 DSPs plus responded, and David only thought he'd get 100. This was the shock.
So I'll take over now. Thanks, Christine. These next couple slides are going to take a look at some of our quantitative results from the survey that we sent out. And then later, David will talk about qualitative results that we were able to get this year. So as you can see, most of our population identified as women. Next slide, please. Independent providers were 26% approximately of the population. 67.4% of the people who took the survey are agency providers. This is also a good place to say that we can't generalize because this wasn't like a random sample. It was a convenience sample. We aren't able to generalize the results of our survey, however high the participation count was, because it was a sample of convenience. So all of these results do not represent all Ohio DSPs, only the ones who took the survey. We can compare our race results with the Ohio 2020 census. You can see that 76% of the people who took our survey were white, in comparison with just general population, 81% were white. And then from there, it's pretty comparable to the 2020 Ohio census comparison, which I think shows that we did have a very high amount of people taking the survey. And then ethnicity, most of the people who took the survey were not Hispanic or Latino. These are some of my favorite results: the age range and how long our participants have been working as a DSP, because it shows that for the people that chose to take this survey, these are the people that have been working for longer amounts of time and have more longevity and industry knowledge than I think, if you were to say all Ohio DSPs. So I think that's an interesting point, especially as we're talking about how long people are staying and whether or not they're choosing to stay in their DSP roles. So as you can see, people are usually ages 35 and up, people who took our survey, and then they have been working for at least 2 years. But again, a majority of people have been working for 10 plus years as DSPs. This is a list of recent job experience or experience that people had before becoming a DSP. This was one of the, I think, this is one of the 4 long answer questions that we asked. And as you can see, it was like a very diverse list. Some people working in nursing homes or in the healthcare field, and some people were stay-at-home moms, or some of them are college students who work in fast food. Do you plan on staying in your role as a DSP over the next 2 years? 63% of our participants answered yes. And then the 37% that answered no or not sure, while it's not in the majority, is still a really large proportion of people who are staying in the role, especially when you're considering how fast the DSP field is growing and how many are needed in the state of Ohio. That 37% or 63% retention rate is not good. And again, this is answered by the same people who have already been working in the DSP field for multiple years, as shown by the age and longevity question. Then how often are you servicing more than one client? 58% said that they were servicing more than one client daily, 24% as needed, and 8% said weekly. This is a really interesting graphic because we asked all of our participants to rank these 5 attributes of or factors from most important to least important. We also said that, we understand that wages are going to be the most important, but try and focus on some of the other options. And what we really got from pointing that out was people saying that, that's not really fair, because this is a job, and just like you have a job, wages are going to be the most important. And by far, that was what we found. Next important was opportunity to support individuals with disabilities, which I think you'll see that too. All of these answers you'll see reflected in some of our longer qualitative responses. Next was supportive work environment, then ongoing training and professional development, and then least important was opportunities for career advancement. Here are some examples of independent providers and then 2 consumers of people who use DSPs in their day-to-day life. You could see that this provider says that they're working 60 hours a week or 48 hours a week. They have 1 Friday off and they're exhausted. And I think especially for jobs that are so, on the move and demanding like DSP works, that's going to be exhausted. I mean, I wouldn't like to work that much at my desk job, sitting in a chair all day. So, and then the consumers, as we know, DSPs are essential to their lives and like maintaining their lifestyle, and they're the ones suffering and they don't have people caring for them.
So I'll take it away from here. This is David again. This was the second half of our project. All of what Lauren just presented was the first year of our project, where essentially we were kind of asking yes or no questions. Could you rank these? But I mentioned that we had all of this qualitative data where we said, we want to hear about your experiences in the field, and then we gave them an opportunity to do that. So among those 950 plus participants, we had around 3,000, responses. So that's what we focused on this year. So in the winter of 2022, each of our 4 project members was assigned to review one of those survey questions for coding. And they would try to code that into themes. What is this person telling us? What is going to emerge? We used a statistical software called Atlas TI in order to do that. So it kind of makes all this qualitative written data something that we can present back in our findings. In the spring, our Lens students were paired to kind of check codes to see if they agreed and that those were accurate. And then those pairings met to consolidate codes and come to some agreement on phrasing and definitions and the themes that were emerging from this data. And that's what I'm going to share with you now. So again, these are ranked in order of what occurred most frequently. And I think that these are our top 5 concerns among the field, but also our opportunities for growth in the field. The first one was pay, then job sustainability, career opportunities and advancements, benefits, and company culture and management. So pay was the most important factor, and I don't think that we should discount that. Even when we were prompting people to give us feedback that might not be directly, tied to wages, that's still the answer that we got. And some of the quotes here I think are pretty telling. One of our DSPs says, "I like the field I'm in, and I also like my client. The only thing is the pay. It's hard to stick around when you have people in the fast food industry making more than you are." And that kind of ties back to the slide that I mentioned, where it's these workers with really technical, almost medical jobs, and they're kind of sandwiched in between people in the service industry. Some noted that other careers pay more money and are less stressful. There was a lot of discussion around just not being able to make ends meet, and that there's no real scheduled salary or pay increases that are enough to keep up with inflation. Some people said that the pay is not worth for the work that they do. They work very long hours and have comparatively little to show for it. Another main theme that stuck out was job sustainability. The ability to remain in this field long term. And that didn't always pertain to wages, but a lot of times it did. So one participant said, "I'm new to the field and coming in is very overwhelming. There's not enough support within the field, and I fear burnout and emotional exhaustion." Another worker said, "I love being a DSP, but I also love my family. I have been working so much that I can't take care of myself or my family. When I do, I feel like I'm letting people down at work." And that was another sort of sub theme that emerged, was these workers sort of sacrificing a bit of themselves to perform these job duties, whether that it's at their expense, the expense of their health, their finances, or their families. Another person said, "I'm a 60-year-old female. I would love to stay and work in this field as long as I am physically able to." We know that this is a pretty demanding physical job at times, and people risk, not being able to perform the role that they love as they age if they're not supported. Another theme that emerged was opportunities for career advancement. One person said, "There's no security in this position. After working as a DSP for nearly a decade, only once was I promoted to team leader, and I make $16 an hour. Still not enough." Again, if you go back to our original chart, you really only saw retail workers making $16 an hour. Again, I would say that these are vastly different jobs. Some people said that they've been with an agency for decades and had their hours cut. Others pointed out that there's no real unions that exist. to help investigate and, ensure that staff and clients are well respected and well treated. And one person said that there really isn't room for growth in this field. I'm self-employed, and having to pay taxes is definitely a downside. Also, no paid time off is something that weighs on me heavily. Which kind of ties into our next theme as well, was overall benefits. A lot of people mentioned that a lack of benefits for health insurance, but that also pertained to vacation time. And I was a little surprised by this, because some of the responses we got were like, I haven't taken a vacation in decades. I just haven't had time. So there may be some, kind of clever, resourceful ways to examine some of these benefits that would make this job more appealing. Again, people mentioned that McDonald's and other fast food restaurants are paying more, that it's just not worth the time and responsibility. And another person said, money isn't everything, but if it isn't, the benefits need to make up for it. They mentioned that some coworkers bring their kids to work because they can't afford childcare. And that was another thing that sort of came up again and again, was people with children, how do they support themselves on this wage, but also their children if they need a daycare or childcare setting. Another theme was called company culture and management. There were some, mentions of that management's hard to rely on, that there's a lot promised and some of that is not delivered on. Some of this was that the job that they were hired for was not the same as what they signed up for. Again, they point out that unions and, there's no unions to investigate or carry out surveys to make sure that people are well respected. And again, that, that these really are healthcare workers and that they're essential healthcare workers, but they're not treated as such. One thing that didn't make our top list was training and ongoing support for DSPs. And I thought that this was kind of interesting. One person said, we're expected to do the work of nurses and other very technical, medical related fields, but we're not properly trained to do that. Some people mention that they're sometimes in dangerous situations and they have to come up with the answer on their own if their supervisor is unable to help. So there was a real conversation about the need for training that supports the technical nature of this work. And some people were not feeling supported in that. But DSPs do want to stay in this role. We're presenting a lot of opportunities for growth within this field, but we got a lot of people saying why they want to stay. There were themes of enjoying the work. That was the top theme for why people were staying in the field. People love what they do. They're passionate about it. That they treat these individuals as family. There were, they expressed the strong ties to their clients. There was some discussion of altruism. Again, I'm willing to kind of sacrifice a bit of my well-being to serve these people that I love. And some people did point out that there were some desirable job attributes, that they liked, traveling, that they liked working with different clients. It was a way for them to gain different experience than they've had at other points in their lives. So DSPs are very committed and overall have some very compelling reasons to stay in the field. I did want to point out this other complementary project by OADSP, the DSP Experience Project. This was a very similar project to ours, and they utilized focus groups, but again, their primary themes that emerged complement ours. And I think that that's really telling, because these were two pretty powerful surveys. And when you get two studies that tell you roughly the same thing, I think there's something there. With this project, DSP's primary concerns, they said, again, I love supporting the individuals that we support. But this often comes at the expense of their own health, their own well-being, finances, life balance, and family obligation. There was, again, robust discussion about wages being too low to support a long-term career, and that people were considering pivoting out of this field because of that. A lack of respect was another theme that was in this study that was often in ours. One that we saw as well is that DSPs often use their own resources to support the people that they serve. You know, they're using their own car, sometimes they're using their own money, sharing or preparing, you know, their own food. So there was this, you know, that resources are shared, that perhaps not enough is given, or to accommodate that. We also saw that opportunities for professional development were lacking in the field. But one thing that this study pointed out that I'm not sure we got from ours is that DSPs are incredibly resourceful and creative. That is a real strength of this field, is that, you know, when faced with constraint, when faced with challenges, these workers will find a way to do it. And that was a really powerful finding by this DSP experience project. And I think it's worth considering, because when asked if DSPs are invited into these conversations to solve some of these persistent problems, I think they will help find solutions for some of the issues that we're discussing. I did want to briefly talk about strategies to improve retention based on our responses. One of the things, obviously, that we could support is wages that are commensurate with the level of responsibility of these workers. One idea that we had that's supported by the literature is that a percentage of the pay for client canceled shifts could improve financial stability and job satisfaction. Again, these were kind of sub-themes that emerged from our data. Paid time off and comprehensive health insurance may alleviate burnout and address a lack of benefits in the field overall. One opportunity is establishing clear paths of career advancement that would promote retention, because people have a clear path of what they can look forward to. Again, I think one of the things that agencies should consider doing, and that we should support in any way that we can, is seeking regular feedback from these workers through surveys or staff meetings to address concerns, because they mentioned that there were not enough opportunities to do that. And then finally, comprehensive onboarding with evidence-based training to promote behavioral skills training, along with quarterly or biannual check-ins, should be implemented to improve confidence in job duties. I won't go into these in great detail, but I did want to include some best or promising practices. We did a literature review, and we tried to find, what are other agencies doing to reduce turnover. A program in Tennessee established a combination of a certification program, an opportunity for career advancement, and a mentorship program, which reduced turnover in their agency by 50% and led to better retention over time. We did find a promising practice from the Licking County Board of DD, their Employment Connections program, which reduced turnover by 46%. And there are a lot of other opportunities here to, I think, examine what's working in other provider agencies or in other provider systems, and determine how we can replicate some of those. Before we wrap up, I really did want to thank the folks attending this call. I know that you were involved in a lot of these conversations. This was kind of a cool culmination of our project, and I wanted to thank you for your time. Our next steps are going to be creating an executive summary of these results that can be used for advocacy. And I'm happy to take any questions that people might have at this time. And you're welcome to reach out if there's anything, that you had questions about, or that you would like us to consider in the future.
So, does anyone have any question you'd like to ask? And we will try to send this out so people could watch it, since there wasn't a lot here today. Carolyn or Eric?
I'm good.
Eric?
I don't have any questions. I might follow up sometime later.
Okay,
Good job, Christine.
thanks. Well, we appreciate the help with the extra help in this, because we just feel this could be a way to show legislators
Yeah.
our research. And I do think, Eric, that maybe in the future, it's up to you guys, but maybe we show these results at a DD caucus meeting. It's only an idea, okay? But we'd be open to that, because they never saw this before. So thanks. I'll stop here. This recording. Where is it?
I'm glad you recorded it.
Where's to stop the recording? That's not good at this.